Cirrhosis is a chronic disease that affects which organ? A. Liver. B. Kidney. C. Heart. D. Small intestine. The answer is A. Liver. Cirrhosis is a chronic liver disease, usually caused by alcoholism. It is characterized by fibrosis and destruction of the normal liver tissue. Patients who have cirrhosis may have hepatomegaly on physical exam, which is enlargement of the liver. For example, it may be felt on the abdomen. Which of the following describes a calcium carbonate preparation? A. Rapid acting, releases carbon dioxide in the stomach, causing belching and flatulence. B. Rapid onset and liberates carbon dioxide, increases intra-abdominal pressure and promotes flatulence. C. Slow acting, contains significant amounts of sodium. D. Rapid acting, is also a saline laxative. The answer is A. Rapid acting, releases carbon dioxide in the stomach, causing belching and flatulence. Calcium carbonate preparation is rapid acting, releasing carbon dioxide in the stomach, causing belching and flatulence. Calcium carbonate is an antacid which reacts quickly with HCl to form calcium chloride and carbon dioxide. Which of the following does the nurse not recognize as a medication regimen for treating Helicobacter pylori infections? A. Triple therapy metronidazole, omeprazole plus clarithromycin. B. Dual therapy ranitidine bismuth citrate plus clarithromycin, omeprazole plus clarithromycin. C. Quadruple therapy colloidal bismuth subnitrate, tetracycline, metronidazole plus omeprazole. D. Single therapy colstipol. The answer is D. Single therapy colstipol. Multiple therapies are required to treat Helicobacter pylori infections. Colstipol is a bile acid sequestrant used to lower blood cholesterol, which is not used to treat Helicobacter pylori infections, a bacterium that colonizes the human stomach. What foods must be avoided in celiac disease? A. Foods containing gluten. B. Foods containing dairy. C. Foods containing red meat. D. Foods containing oat. E. Foods containing wheat. The answer is A. Foods containing gluten. Celiac disease is an autoimmune condition that is triggered by ingestion of gluten, a protein found in wheat, barley, and rye. A wheat-free diet is not sufficient for a patient with celiac disease, as many other products contain elements of barley or rye and thus also contain gluten. Oat, while often avoided by individuals with celiac disease due to cross-contamination during processing, does not contain gluten. Whole dairy products are also generally gluten-free and considered safe for patients with celiac disease. Samantha is a registered nurse working in the intensive care unit with a patient recently diagnosed with Clostridium difficile. She violates Clostridium difficile contact precautions by A. Donning only gloves and a gown before entering the room. B. Placing the client in a semi-private room with another patient diagnosed with Clostridium difficile. C. Placing the patient in a private room. D. Cleansing her hands with only alcohol-based gel before leaving the room. E. Cleaning surfaces with hypochlorite-based disinfectants. The answer is D. Cleansing her hands with only alcohol-based gel before leaving the room. Clostridium difficile, C. diff, is an infection caused by Clostridium difficile bacteria and requires contact precautions. Contact precautions state that nurses must wear gloves and a gown while caring for the patient. Nurses must also perform adequate hand hygiene before and after the use of gloves. Additionally, because C. diff infections are caused by spores, alcohol gel alone may not be sufficient to eliminate the bacteria. Current practice is the use of soap and water to cleanse hands. Afterwards, nurses may utilize alcohol-based hand gel. It is acceptable to place a C. diff patient in a semi-private room with another C. diff patient if private rooms are unavailable. Carrie is caring for an 85-year-old woman in a long-term care facility. Her patient has been taking antibiotics for the past 2 weeks to treat a severe case of cellulitis. Carrie notices that her patient has developed a fever, has refused her last 2 meal trays, and is complaining of abdominal pain. Which of the following samples should Carrie seek permission to obtain? A. A blood sample. B. A sputum sample. C. A gastric fluid sample. D. A urine sample. E. A stool sample. The answer is E. A stool sample. It is possible that this patient is suffering from a Clostridium difficile infection caused by bacteria. The presence of an underlying condition, increasing age, and antibiotic use are all risk factors for contracting Clostridium difficile. A stool sample is commonly used to test for the bacteria. Until the results are available, Carrie should place the patient under proper C. difficile contact precautions. A female client with advanced cirrhosis of the liver has noticed that her abdomen has become greatly distended and she is concerned about her body image. The client asks the nurse, "What is causing my stomach to look so big?" The nurse responds based on her knowledge of liver disease and possible signs and symptoms. She tells the client which of the following explanations for her distended abdomen. A. Cirrhosis is highly associated with severe constipation and the accumulation of gas in the peritoneal cavity causing distension. B. An accumulation of nitrogen waste in the bloodstream due to the liver's inability to transform the waste to non-toxic substances causes ascites. C. The liver is producing excess cholesterol and it has accumulated in the interstitial spaces of the abdomen. D. The liver's inability to make clotting factors due to vitamin K deficiency causes internal bleeding into the cavity. E. Elevated blood pressure in the liver and the liver's inability to synthesize albumin causes fluid shifts in the abdomen. The answer is E. Elevated blood pressure in the liver and the liver's inability to synthesize albumin causes fluid shifts in the abdomen. Portal hypertension causes proteins to move from the bloodstream into the lymphatics which cannot handle the excess and they leak into abdominal cavity. The proteins causes an osmotic pressure pulling fluid into the space leading to ascites. Hypoalbuminemia will lead to decreased colloid oncotic pressure as well, also contributing to ascites. Which of the following bacterial species is responsible for the development of peptic ulcers? A. Treponema pallidum. B. Viridans streptococci. C. Staphylococcus aureus. D. Streptococcus faecalis. E. Helicobacter pylori. The answer is E. Helicobacter pylori. Helicobacter pylori or H. pylori is the bacterial cause of peptic ulcers. Staphylococcus aureus is a bacteria that frequently causes skin infections along with other conditions such as toxic shock syndrome. Streptococcus faecalis is responsible for many urinary tract infections, and contracting viridans streptococci may result in endocarditis. Treponema pallidum bacteria cause syphilis. The nurse is caring for a 25-year-old patient diagnosed with a poorly functioning lower esophageal sphincter. The nurse may advise the patient to do which of the following? A. Avoid alcoholic beverages. B. Limit water intake. C. Lay down immediately following meals. D. Avoid ingestion of antacids. E. Avoid whole grains. The answer is A. Avoid alcoholic beverages. Several foods can cause relaxation or irritation of the lower esophageal sphincter. Alcohol, carbonated beverages, and chocolate are a few examples. Advise the patient to remain upright after meals, to utilize antacids when appropriate, and to practice a balanced diet. Which of the following GERD medications works by neutralizing stomach acid? A. Famotidine. B. Magnesium hydroxide. C. Pantoprazole. D. Ranitidine. E. Omeprazole. The answer is B. Magnesium hydroxide. Magnesium hydroxide is a strong base. It works by neutralizing the acid in the stomach, forming water and magnesium chloride. All other listed medications work to prevent the stomach from overproducing acid, rather than neutralizing the existing acid in the stomach.